Well, hey, everybody who's joining. It's Christian Payon, techie surgeon here. We're just doing Founders Coffee. So me and my co-founder here, Hadi, we kind of get together every Saturday or Sunday, usually around 6:30 or 7. And we kind of run the company, if you will, and just talk about what we're going to do. But I figured we kind of might as well just chat with everybody else and tell them what we're up to. And I thought it would be a nice opportunity for folks to hear from Hadi, kind of hear his story. He's got a great one. He's a builder, awesome engineer. So, Hadi, why don't you introduce yourself?
Yeah, absolutely. Thanks for having me on the pod. I'm Hadi. Um, I am a software engineer by heart. Uh, I'll walk you through my career. One of my early career highlight was working for Capital One, the credit card company. I deployed AI back in 2016 and 17 when AI was not that cool and less practical. I was applied AI engineer there and one of the very first earliest hire, believe it not, to build voice AI for banking. So essentially where consumers can call the chatbot to know about their finances, move money and whatnot. So it was really difficult to work in a highly regulated environment at the scale of Capital One, where there were millions of customers. And I got to learn how to deploy AI at that point in time. Uh, but there were tons of problems, even though the text-based modality had a lot of product market fit, but the voice wasn't there. It would get date of birth wrong. It would get credit card numbers wrong. Uh,
Oof.
and always believed like one of these days this is going to change. I also read the paper at that time from OpenAI. The title was Scaling Laws. And they argued one of these days when we'll scale up the compute, all the GPUs and NVIDIA compute, AI would become very practical as you keep scaling the compute. I was like, that would be so cool. And surely that happened in 2022 ChatGPT moment.
Yep.
But after Capital One, when I was working at Capital One, I lost my soul working for enterprise. A bit. I was like, I wanted to do something more impactful, and obviously, healthcare was there, but did not know where to start. Most of the builders, software engineer builders, have this problem. I was never a domain expert in healthcare, even though I have docs in my family. But
Yeah.
always was very excited. So I partnered with my co-founders, Shilan and Jake. They were doing masters in public health at Harvard at that time, and we started working together. The idea was kind of stupid, but it ended up working. The idea was paying people for healthy habits, essentially. So paying actual
Hmm.
rewards. There was a lot of literature out there that at that point in time where CDC tried paying people to quit tobacco by sending payment vouchers through mail. But no one had tried just in time intervention where you're like, hey, you have a biomarker sensor, breathalyzer device to prove us you're not smoking. And we're going to give you dollar rewards at that point in time, actual dollars in your bank account to spend money anywhere. So we ended up deploying that solution for Medicaid population, low socioeconomic demographics in America, helping them quit tobacco. And this was at Vincere Health. So we built a mobile app that would nudge you 2 times a day. There was a breathalyzer sensor that would detect carbon monoxide in your lungs. And every time you would prove us you're not smoking, we'll give you dollar rewards. So now the question becomes is where would that rewards come from? If you're paying $300 to someone to quit tobacco, how do the funds flow? So we started partnering with a lot of like insurance companies who were running these rewards. And today, the way this whole quit tobacco infrastructure works is there is 1-800 quit now line that every state operates, funded by state tax dollars. And then they contract it out to carriers like Optum, National Jewish Health, and a couple of others, Aetna and others. So we kind of plugged into brick and mortar infrastructure of quitting tobacco. And there were a lot of priority populations like pregnant smoking 2 packs of cigarettes. And that's where Vincere was deployed, helping them quit tobacco and earn rewards. It was very gratifying and cool, but also learned engaging Medicaid population or in general population is very hard. It's not that easy. There are tons of healthcare applications out there, but engagement is so difficult and tricky. Yeah.
Yeah, incredible. Yeah. And look, I today still have a ton of difficulty getting my patients to quit smoking. And, and I live in Durham, North Carolina. It's the tobacco kind of, like ground zero, if you will. We've got the American Tobacco campus here, and it's a tourist attraction. So it's still a huge problem, still contributes a lot to poor outcomes for patients. And it's so hard to get people to quit. But even upstream of quitting, just getting patients to engage is really hard.
Yeah.
So I would love to hear some of the lessons you learned while you were there around technology. You were into chatbots before the world was, right? And it was very serendipitous that we met when we did. But
Yeah.
what were some of the lessons that you learned on that first go around? And maybe, I think that obviously, I know that you exited, but everyone else doesn't. Maybe you can tell us about just that experience and what it was like as well. So
Yeah.
lessons learned and the path to startup exit.
Yeah, no, absolutely. So I would start with the exit. Obviously, Optum was the largest customer we got. We had a couple of health systems like Memorial Sloan Kettering, Frederick Medical Center as well. But Optum was the natural home for the company. They own about 30 state tobacco quit lines in America. And we thought we found a good landing. And the experience was more around, okay, how do we bring this tech into their
Right.
ecosystem and integrate and deploy and see the impact? Um, in terms of like real world experience of deploying chatbots, I think one of the early lesson was we're like, people want to chat to chatbot. And people love AI bots. Um, I mean, as a naive engineer mentality, that was always what.
That's what you guys thought.
Yeah,
Right.
it's so incredible to talk to a machine or silicon. Maybe they would also love talking to a chatbot. But the reality is people hate chatbots
Yeah, people don't
immediately.
like talking to robots.
Yeah. Yeah. I mean, they like to talk to humans. And that stands true today as well, besides all the innovation that has happened. So I think as long as the chatbot is not providing unique value, it does not work. And
Yeah.
I think, Christian, you and I talked about this many times when we design solutions. Empathy for the sake of empathy does not work either.
No.
Yeah.
No, this is so funny. Like, yeah, I think that everyone thinks that speaking to ChatGPT on their app is so cool, but that's because in the moment you're doing it for leisure or kind of in a creative sense. But if you just want something done, you just want it done, right? And I think it's funny, we haven't seen a lot of big peer reviewed articles about the success or failure of voice AI, but we did see some big companies kind of pull back on voice AI. And it's reflective of our experience deploying these chatbots. They're great to offset labor, but if you want to really improve the patient experience, you better be delivering value. Like you got to book the appointment, you got to look up
Yeah.
the right information. And it sounds like that was your experience. That
100%. Yeah.
yeah,
Yeah. So, like, people only would chat to chatbot if it solves their needs, or if it's shown as a proxy of humans, with the right
hmm
amount of connection. So at that time, if people were able to move their money without calling an agent, yes, it works. But for general chit chat, they don't like chatting to.
no,
Yeah.
no. And I almost think like sometimes people prefer texting, like chatting by keyboard almost, or dictating over a dynamic interaction, just because of almost the uncanny valley.
Yeah.
Um, yeah, yeah. So that's definitely been our experience too.
Yeah.
Um,
But even then, there are certain circumstances where people need human. So let me give you an
oh
example.
yeah,
Your credit card is lost, even though today you can block your credit card through mobile app. They just wanted to hear human to assure
yes.
someone is not spending money on their credit card, and they would not trust a chatbot. They just
No,
need human touch at that point in time. So that was another learning lesson.
yeah, I think there's a lot of excitement around voice AI, and it does feel magical the first time you interact with it for a leisure reason. And maybe you're kind of pleasantly surprised at how smooth it is if you are dealing with it for a health or commercial reason, but it's just not as good as a human, right? And I think that that's been our philosophy is it augments workflows and it's got to complete the task. And if it doesn't complete the task, then it's kind of like fancy voicemail. And there's almost more value in the summary of the encounter than there is in the experience of the voice AI getting deployed. So I'm always skeptical when I hear people saying, "Oh, people love, our voice chatbot," and they might love the outcome that the voice chatbot brings, but it doesn't really replace the human, right? It can substitute and augment people, and that's definitely been our experience deploying appointment scheduling agents and all of these things.
Yeah.
Um, Tell us about the exit, the path to exit. A lot of founders and builders who I think end up listening to Techie Surgeon. You've been through it. You guys like saw the light at the end of the tunnel and did this interesting thing where your biggest customer ended up being your acquirer. What was that like? What was the period leading up to it and afterwards like? And then maybe we'll jump into some other topics after.
Yeah, absolutely. I think you never build for exit. That was the learning lesson, especially in healthcare. If you're building for exit, you might be taking shortcuts. And doing things right is really important. At Vincere, when we started, we had a peer-reviewed study with Boston Medical Center to make sure, like, hey, we are able to deliver outcomes by a financial reward-based habit technique and using a breathalyzer sensor. Doing things right is really important. And the reason I say that is I have seen a lot of founders in healthcare, not to name names any,
Yeah.
who look for shortcuts.
Yeah.
Healthcare doesn't work that way, unfortunately.
Yeah, we've seen a lot of unfortunate stories, both of, precarious half truths, if you will, told by health tech founders and companies. We've obviously seen outright fraud. And then a lot of these companies have just failed, even though they have the outward appearance of success and have raised hundreds of millions of dollars. We see them kind of crash. And here, this is in the headlines, right? Babylon, Olive, like there's all these companies that outwardly seem like they're doing great, but then you dig past the first peel of the onion layers, if you will, and
Yeah,
and things are hard. Health technology is super hard because
yeah,
it's people and processes, not just the software.
yeah. No, 100%. And I think there is another problem. Just like to give you tell you like how it was leading up to the exit. Um, so venture capital in healthcare needs to change a bit as well because venture
Absolutely.
capital have to deliver returns to their LPs on a very short horizon, and that creates a lot of unnecessary pressure on founders when you raise through VCs. I think now we are seeing smaller funds evolving. Uh, Revel, I have those investors, and we're really fortunate to have them. But back in ZERP area, zero interest rate period times, 2019 to 2020, there was insane amount of capital flowing into healthcare, and we were kind of jealous whenever we
Yeah.
open LinkedIn. We're like, some company raised $30 million on 100 million valuation, and honestly, sometimes we would ask questions to ourselves: How would they justify this valuation? Would they able to
Hmm.
make much revenue? And for companies to justify that revenue, they would take shortcuts. Unfortunately, that was the insane amount of pressure put on them. There were many times where we felt like we're gonna die and not figure out product market fit. We both a roller coaster ride. I guess we just kept building. We loved building. We wanted to see the outcomes, and that's where we was. And we started with a study with Optum as well, like a controlled pilot to showcase, hey, the solution works, rather than doing a mass deployment across multiple sites. Uh, and then it led towards the conversation of parity of two tech stacks and how our tech stack can complement them.
Yeah, that's phenomenal. Yeah, yeah, and I think that and not most companies are not so fortunate, obviously, to make it to the exit. But the other thing that happens is you get to that finish line, and now you're an exited founder. so so I think it's funny you have this experience, and then it really amplifies your ability to start another company too, which is great.
Yeah,
What was the period after the exit like? Did you have some golden handcuffs? I know you've got some limitations on what you can share, but I think it would be great to hear, um, for the listeners, like what was it like after you made the exit?
yeah. I mean, generally, not to share much here, but generally, the rule of most of the times, the way it works is either it's going to be acqui-hire, a company is interested in the team, or it's just the technology acquisition. The technology alone acquisitions are not very common anymore because technology without people is not that valuable. You need
Mhm.
people who can integrate the technology into the system. And usually there is an earn out period for founders, depending on your role. If you're a go to market expert, maybe your milestones will be on go to market side. If
Right.
you're a technical person like me, your milestones will be on the integration side, like you able to integrate and earn out your shares value. And it was pretty similar for us as well.
Yeah, yeah, there is like this kind of, like you said, these milestones. So I think that people think sometimes you you exit the company and you go sail off into the sunset, but usually usually there's a little more work to be done,
Yeah,
and the thoughtful founders will say, "Oh, the work just began. Actually, now we're part of this merger. We're trying to actually
yeah,
make what we built scale beyond what we already scaled because this was a strategic acquisition." I think that people forget about that for sure.
yeah,
I see a really great comment from Juan Estrada here. It's so interesting how LinkedIn is all about raising money and financial results, but no clinical outcomes and how docs work hard to help people. I
yeah,
totally agree with that. There's a lot of these really glitzy stories about, X company raising 8 million, 20 million, 30 million. And we just actually submitted a peer reviewed publication, or manuscript, on our med refill agent. And I really think it's the first study that's been submitted of an AI assistant actually interacting with a patient in this way for a med refill. And it's going to not just like actually submit it to a peer reviewed journal. It's the first one, but there's plenty of companies obviously doing it. And sometimes you can't wait for the research, obviously, in technology, especially in AI. But we need more data. That's definitely true. And I will also say that we obviously get to speak to founders kind of behind the scenes a little bit, and you shouldn't always believe what you see, right? From a marketing perspective, this journey is super hard. Even the companies that look like they're outwardly very successful are going through the same roller coaster of really challenging long sales cycles in healthcare, or beating back competition, or trying to improve the patient and clinician experience. Even these companies with billions of dollars, they're having these same issues for sure. So that's what I've seen at least.
yeah,
Hadi, where's AI going? Where do you think clinical AI is going? What's the future? You mentioned something interesting about um,
yeah,
tech and people.
yeah. Absolutely. Um, I think it's a broad question. Generally, we see a lot of value clinical AI is going to deliver. But I would start with why is it not moving as fast as it should beyond Scribe? Um, as you guys all know, the data gravity or general data gravity lives in electronic health records, Epic, Cerners, Athenas of the world. And without that context, you cannot do much with AI. You can do only enough. But beyond that point, you need that data to be available in AI. I also think AI is not the bottleneck, it's the context that's the bottleneck right now. Uh,
Yeah,
Models are pretty smart. We all know that. But then, if you cannot get patient chart information securely into AI, or if you cannot get past encounters into AI, yes, you can prompt open evidence, but it's a
right.
very reactive way of using AI because you have to prompt it, copy information here and there, or into Copilot if it's approved in your organization. And I think in some other places, what we're seeing is in other adjacent industries, since there's more open data ecosystem where you can pull data, obviously with care, those industries are moving faster
Yeah,
to healthcare. Um, and something needs to change here.
yeah.
Also, I think a lot of these features, because large electronic health records host this data, they might want to be building themselves rather than opening for founders and other ecosystem who can build AI really fast. But it is yet to be seen. But that's the case we see right now.
I totally agree, and I think that one of my things with generative AI in general, but in clinical AI, is these tools are only as good as the context that you feed to them, and the context is behind this walled garden in many cases, and that has definitely slowed adoption. There is this kind of similar, I think, like dichotomy. AI has had billions of dollars poured into it. There's a lot of it. There's this narrative that adoption in AI has never been faster before, and in healthcare systems in particular. But you and I see it. We're going to a lot of places, and I recently was speaking to a room full of chair people from across the country, and a lot of them were like, "We're starting to use ambient scribe, and we're
Yeah.
really excited about it, but we're worried about the errors." The most robust large systems like they are not necessarily having patient-facing clinical AI, even almost 4 years after the GPT moment. And so there is this kind of, I think, there's the story we see, and then there's the reality.
Yeah.
And change management is so hard still, as you and I know. The and I think you agree with me. There's kind of this other market of not trying to force people to change the way they do work with AI tools, but
Yeah.
augmenting them with kind of the outcome as opposed to the software, if you will. And that's
Yeah.
probably where we'll see sharper adoption as these new models evolve.
Yeah, 100%. Just leading with the outcomes, and doesn't matter if it's delivered by AI or human, it could be a good model. I think I would add another thing. There's a huge amount of coaching that needs to be done. So like you cannot just build an AI solution and pray people will use it. You need to train the
Yeah.
staff to work with it or augment them. And there's not a lot of consulting happening. I think that could be very cool.
Yes, yes. I mean, I think you and I have seen this. The change management is really difficult. There's a whole industry that has not been tapped for upskilling people in artificial intelligence. That's both in the consumer, I think, commercial space, but definitely in healthcare. Even I think at AI forward organizations, just the majority of people still are using GPT to ask about their groceries, or maybe they're querying open evidence one or two times and really excited about the information that it comes to them. But people haven't been trained on the limitations of generative artificial intelligence or clinical AI, like the ability to use these tools for your workflow or what a Claude skill is, right? We're going to talk a little bit about that. Most people just have no idea.
Yeah.
And there is no centralized resource for it. And I don't think one will necessarily emerge, but there are these opportunities for some of the super AI users or these companies to, alongside their software, sort of have strategy and upskilling that gets deployed. And that's
Yep.
definitely been our approach. I think that Techie Surgeon is trying to do that a little bit too. I know Edward Del Sol, I see on the live chat. I like to think of him as a Techie Surgeon acolyte. Now he's vibe coding and he's building web apps. And again, the context is what makes these things so useful. So, I won't ask him to share it now live or put pressure on him, but he's built really cool, interesting surgeon specific tools that you would never think of if you were, not a surgeon. And I think empowering people to use these tools for that reason is going to be very powerful, as well as kind of putting alongside your software deployment the outcome and the upskilling deployment so that
Yeah.
you really transform these organizations, at least for workflow software. If you're totally back end, then maybe it's
Yeah.
different.
100%.
Security and compliance. There was a big headline recently, really disappointing headline around this YC-backed company, Delve. It's always sad to see, these companies that seem so promising then have something so nefarious, if you will, or at least allegations of malice pop up. For those of you who don't know, there's this Y Combinator backed startup faced allegations of fabricated compliance certifications for its clients. So SOC 2 compliance, it's a huge sort of initial audit requirement and certificate that you need, usually, especially in health tech. And unfortunately, it sounds like this company for hundreds of startups was um, basically providing fake compliance certificates. At least that's what the headlines are saying. And a lot of really great companies are affected by this. NoTex, Whisperflow. I mean, a lot of companies that are doing good work out there. And I think that they're probably now scrambling to figure out the validity of their certificate. What were your thoughts on this story? Obviously seemed like a really promising, fast-growing company. What do you think, Hadi?
Yeah. So just to let you guys know, there were about 494 SOC 2 Type 2 reports that were fakely generated. And the way industry got to learn about it is there was this one Google sheet that was left open for the internet, and some anonymous substacker got access to it and started peeling off different layers of onion and trying to figure out what's going on. So 494 reports, fakely generated, fake HIPAA compliance report, fake GDPR reports as well. And then what they realize is all the 99% of the reports were identical. They had the same boilerplate text. Uh, and also, even before the evidence was gathered for SOC 2 Type 2, they already had prefabricated assessment from auditors already.
Wow.
Yeah, and then after once this story went live, another developer on X got access to their database as well. So that tells you how that company was treating data in general or security in general. So I guess like what builders in this space should do is they should not see security as a cost center. Uh, I'm gonna share when we were doing SOC 2 Type 2 at Revel. We saw again LinkedIn stories about, hey, we got our SOC 2 Type 2 done in 3 weeks. And we were like, are we doing something wrong? Why is it taking such a long time to us? And it was really hard to believe even at that time. Like, how can you do SOC 2 Type 2 in 3 weeks? And this is not something to present or be proud of. Like, if we got done our
Mhm.
SOC 2 Type 2 in 3 weeks, and that's exactly what this startup was selling. I would also say you can't outsource security responsibility to Delve alone, even though what they did is a
Yeah.
huge misconduct. But if someone is, let's talk about HIPAA maybe. If someone is trusting with your patient data, you have a huge responsibility to protect it. And you
Yeah.
can't see security and compliance as your cost center. It's not. It's the most important thing, foundational thing you have to do. And the mentality in startups was, hey, let's get this done as fast as possible. But no
Yeah.
questions. Are you doing it the right way or not?
Yeah. It's a huge problem. And I think we faced that same that same kind of FOMO, if you will. We went through Vanta and right, we kind of checked all the boxes, but we were also really rigorous around governance, and it was frustrating because this was kind of stopping us from moving down the procurement pathway at
Yeah.
several large hospitals and health systems. And you see, like you said, these other headlines, and you want to move faster. But in
Yeah.
healthcare, the move fast and break things mantra
Yeah.
will also break your company. And I think we took the right approach, in
Yeah.
ultimately just kind of biting the bullet and saying, like you said, security and compliance and governance, particularly of our AI models, is,
Yeah.
a cornerstone of it's a feature, right? Not a bug.
Yeah. It's
Yeah.
definitely a feature. And I hope this does not happen. Large health system CIOs are either skeptical to partner with startups for good reasons, obviously, because they want to make sure security is there. And that's what Epic delivers. It's one of the most secure
Right.
platform. And one bad actor like this can cause, a bad repute for other startups in the industry. And I hope that does not happen because people
And I think it
genuinely,
will,
yeah,
right? There's totally gonna be a ripple effect and a chilling effect for other companies that, maybe were about to finish their procurement process, and maybe we're using Delve, and now
yeah,
you're kinda back at square one, and there's going to be more scrutiny, in an already pretty rigorous, process for these AI health tech companies. So, I think that founders have a huge responsibility in healthcare, obviously. We also have a responsibility to one another because when we become bad actors, it affects the entire industry, and it's really unfortunate for sure.
yeah,
All right, enough about the security and the compliance. Tell us a little bit about some of the exciting things that you see AI doing. The title of the podcast today is Claude Skills for Clinic.
yeah,
Maybe for the users, if you want to, the listeners, if you want to explain what a Claude skill is, we've definitely had some techie surgeon
yeah.
posts around this, but we can do a little bit of show and tell if you want after you kind of just discuss what it is and how something like this could be used in healthcare.
Yeah, 100%. So just to level set with everyone, what is a skill? Um, a skill is a structured set of instructions that you give to your AI to accomplish a task. In a nutshell, but think of it like a manual or like structured instructions you can give to your employee to follow when a certain situation arises, a certain task needs to be completed. But for AI, but the skill is just for AI. You're just teaching AI how to perform a task at any point in time. One example could be, let's say you let's take an example of maybe ambient scribe here. Maybe
Yeah.
good example. So you're like, ambient scribes usually have very structured notes, HPI or other kind of formats of notes. But you like, every time someone mentioned diabetes, or every time someone mentioned, well, BMI maybe at 30, I want to do dietary counseling, or maybe I want to do glucose monitoring later and have it in my notes. But see, the difference here is you only want to trigger that logic when that keyword is mentioned or when patient mentioned they have diabetes. And that's where skills come in. So you can just by talking to your AI, you can have instructions for the AI. Like anytime you see someone mentioning diabetes, just trigger this workflow. Maybe draft a documentation for my staff member to take a look at it, but also draft a documentation or messaging for patient as well to create it. The difference here is, instead of having pre-structured workflow of AI, you have very task-specific workflow of AI. It's a subtle difference, but that changes the whole picture because now you have so many skills that gets triggered on certain edge case scenario. And what we see is, especially healthcare workflows are very if then else logic. We talked about, if BMI 30 do this, if they have diabetes go on this path. And traditionally, with software systems, it was so hard to scale healthcare because who's going to build this if then else logic? Are you going to rely on your dev team or maybe Epic consultants to build it? And that takes forever. And this changes the game altogether, where your if then else logic or your clinical protocol can live as a skill, like what you need to do, and AI follows those instructions at a high level.
Yeah, it's amazing. And anyone who uses Claude Chat or Claude Cowork knows about this maybe in their everyday life, where you might say something like, make me a PowerPoint in modern enterprise style, Revel AI branded. And because you have a skill that has before showed what the end product should look like for modern enterprise. And because you have a Revel AI branding skill, the colors get applied to your end product and you don't have to prompt all over again, upload your branding. It's both context, but it's the automation of workflow. So like Hadi was saying, that could be magic in healthcare. There's so many times that we have kind of the same sort of workflow with a certain context that needs to be applied and then have information surface to us. So maybe another example is I've got my clinic on Monday and I want to, hey, run pre-screen skill for my Monday clinic. You can imagine an agent going, looking at all the different charts, seeing who's missing an imaging order, and then flagging those patients to you. Maybe you want a specific blurb for those patients in a style that you like. With a skill, you could do that. You're basically kind of deploying like an agent to do that. Oh, there's a good question here. For someone who's using Epic Ambient Scribe, can they use Claude Skill within the system? Do they pair, and is this HIPAA compliant? No. And I do think they're coming out with some features. I saw someone talking about how they're going to have it so that the Ambient Scribe learns your style moving forward. To me, that's not a skill, by the way. Like that's kind of a little bit of augment of the prompting. I'm sure they'll come up with something like this. Um, but it'll just take some time. We're deploying in several other electronic health record systems where we're querying the FHIR resource and then creating these workflows from the context and the input.
Yeah.
Um, you definitely can. For Andrew in the chat, Andrew asked for someone who's using Epic Ambient Scribe, can they use Cloud Skill within the system? Um, you definitely can in some of these scribes. I'm not familiar with the Epic Ambient Scribe. I am familiar with Abridges Scribe. You can like customize the template a bit so that it's different when you have your next patient kind of come through. Maybe it formats a part of the note more concisely or in a longer fashion.
Yeah.
But I haven't seen skills deployed yet, personally at least, and I've gotten exposure to a lot of I think this software, but it's a huge potential. I think people will move there. I think systems of records will go there.
Yeah.
But yeah, Hadi, what are your thoughts on other examples or ways that skills could be deployed in healthcare?
Yeah. Just to reply to Andrew, I think Epic have a huge potential here. You already have dot notations for node templates. I could always imagine for skills you have something similar, where you can customize a skill under annotation and have it deployed based on keywords. It could be so cool. And I think the first application of skill is ambient scribes and what the output you want it to produce or downstream task you want it to produce. Some of the other examples of skill, interoperability is a huge challenge. So we're talking about skills, but yet again, we can't get context outside of Epic, because you need to integrate uh, and not just Epic, like other EHRs as well. So Anthropic posted Fire skill on their marketplace. Their engineers spend a lot of time understanding HL7 and Fire, all the healthcare data exchange terminologies. I know this might be a controversial take today. Uh, I I think in a year or two, we're gonna see engineers or startups not writing code for integrating with EHR, and there will only be a skill. Skill is not just a prompt in engineering terms. They could also be scripts, like on how you should be pulling patient chart data, or how you should be looking at observation resource, past medications, encounters, and other information. And you give that skill to AI and an integration pathway to Epic, Athena, or others, and AI just executes the command without engineers writing the code. Now, today we'll say, oh, it will be super unreliable. Yes, it is today. But in future, the way industry is moving is you will have AI or LLM as a judge, looking at each and every step and validating through data evidence, are we executing the right commands at the right time? So in short, I would define the current state of integration skills into online and offline. So online means whenever a provider queries a system, skill execute in real time and pull context through interoperability from EHRs using that skill. That is not happening today in its current form. But offline means is engineers have access to these skills. Um, like I'll give you an example. I was able to integrate into Cerner proprietary APIs in 1 hour because of the right amount of skills that I built with AI versus it would have taken 2 weeks earlier. But that is an offline use where I used it to bootstrap the code and everything to pull the data, but then I'll validate it myself and check it into the code. So that's the offline usage of the skill. And we see a lot of integration code today is being written using that kind of methodology. The second thing is, I think thinking about other workflow driven or compliance driven protocols. So like think of it like instructions for your staff as well. Imagine your staff leaves, they knew how to deliver care post-op or pre-op. If you have pre-baked instructions into AI, it could be used as a training tool as well for your staff as well. Like 10 days post-op, you have a very customized workflow. 30 days post-op, you have another customized workflow. And that can also be used for data analytics as well. One day, if Epic launches this feature or a startup integrating with Epic, Christian, you already kind of alluded towards it. You can ask questions like, how am I doing on Teams model?
Yeah.
And you have all the instructions in a skill on how a Teams model is delivered for AI. It can query patients. It can see how many patients are 30-day post-op or 1 year post-op, can build task list for you to action on. And a lot of it is happening in Excel sheets today.
Yeah.
Healthcare is delivered in Excel sheets for these kinds of things.
Yeah. Yeah, yeah, and I really think of these skills eventually being able to be deployed by the clinician or designed by the clinician without code, right? And being able to, your point, have let's say, a transforming episode accountability model, mandatory bundle. Let's say you wanna run on 60 patient panel, you want the list of patients who came back to the ER within the last 5 days. You also wanna draft a follow-up message to those patients in a specific style, and then you want, let's say, in addition to that, an AI agent that goes and calls the patients that are highest risk and then reports back from that agent that's called the patient to you a structured note. That's like 6 steps, but you
Yeah.
do it once, you describe it, and those 6 steps happen. And maybe now it's team post acute query skill, and you just deploy it. Like that's the I think that, yeah, to your point, a lot of people are thinking like, oh, like, can this just learn and change my prompts over time? We're thinking about these multi-step workflows that could truly be deployed.
Yeah.
Um, And, I think I'm gonna let Hadi share his screen, but just to maybe like make it a little more intuitive to people for people too. Um, you know, I have my Claude chat open here. I'm gonna say make a patient storyboard using VO3 skill Revel AI branded for CHF patient education program. Uh, it should be at a fifth grade reading level. I'm gonna kick that off, and I don't usually use Claude AI. I use Cowork, but what you're gonna see as this goes is it's going to start to execute not just on this prompt, but it's going to pull back into deliverables. See, here you go. So VO3 video skill. So I, in the past, have made it so that when I say VO3 video skill, I get a series of short prompts organized in a way. So Claude making the prompts so that I can take those prompts and then make images and make the video. It's a workflow automation. Saying reading the Revel AI branding skill so that I didn't have to put in my colors and my logos or anything like that. It's just pulling back and taking that information so they can create the deliverable. And maybe the deliverable is, in this case, an Excel sheet or a series of prompts. You can actually, I was just playing around and it's a little buggy. I'll have to ask Hadi to help me. But I'm actually trying to put together something that will automate end to end the video being made. So like several steps in a row. You can imagine the same thing in healthcare where you have multiple steps that you want to execute in a row and they're similar over and over again, right? Like morning daily sniff rounds, and you want the AI to query the fire resource that is showing the discharge disposition for a panel of 100 patients. It's identifying the sniffs, and maybe it's making like a little Excel sheet or an interactive component or user interface. So maybe that like makes it a little bit more intuitive on the skills. We're gonna have the infinite loop here. Look at that. But what I'd love to do is let Hadi share and just give an example of kind of how he's thinking about skills and maybe a little bit of a show and tell on how we've been trying to do it at Revel, just as one example.
Yep. Substack Live takes some time on my computer to let me share my screen. Just give me a second, guys.
Now, the theme for Substack for me has been glitches.
Yeah.
Great question from Jared. With all the AI native tooling coming out for documentation, billing, prior auth, RCM, do you think independent private practice could actually make a comeback if physicians ditched the big HR and ran on a lighter stack? I 100% think that there is an opportunity for these smaller clinics and independent physicians to get upskilled on software, on generative AI, and equip their clinics to be more efficient, to automate prior authorization appeals, all these other things. I totally think that that is possible. And again, I think Ed Del Sol is on here somewhere. Me and him have been talking about this kind of agentic clinic idea. We've been talking about this at Revel too. I think there's two versions of this. There's like just upskilling people at a small practice to be able to use something like, the Claude for healthcare tool and have it pull into their emails or Slack or whatever. That's again HIPAA secure to automate some of their processes. And then there's the actual maybe app development or kind of like stack that allows you to automate more of those processes. And hopefully that does end up making private practices a little bit more robust and able to keep up with MIPS requirements, reach out to patients and more for sure.
Yeah.
Hadi, what are your thoughts?
Um, I think I 100% agree. Also, it feels like this wave of AI is making individuals more productive rather than organizations productive. Because individuals can go out, explore AI tools, and make their lives productive. But for an organization to adopt AI, a larger org to adopt AI, it takes them a long time in procurement life cycle. And I think there's a really cool opportunity for smaller clinics to adopt AI. One of our design partners, Dr. Ejiman, Kofi Ejiman at ASAP Ortho, I saw some of his AI workflow, and it was really cool to see how quickly they're adopting AI because of being a smaller clinic and have more power. Does not have to go through IT procurement cycle. And I truly believe smaller clinics have an opportunity here.
Big time. Is your share there? You go. Oh, there.
Yeah.
So we got the share going, and
I
I'll
want
make a
to,
very small and oh, go ahead. Go ahead.
are you able to see my screen?
I am. I am.
Cool. Sorry, were you mentioning something before
Oh,
I?
I was just gonna say, for those who are interested, we are going to have on Techie Surgeon, the Clinical AI Leadership Institute. That's going to be 30 folks that are selected for kind of an intensive virtual webinar, primarily clinicians, but also healthcare leaders. We'll have an announcement around that and people who can sign up for the wait list. And for Revel AI customers and folks who are already working with us, we'll have more opportunities for you to kind of upskill, if you will, on these tools. But go ahead, Hadi.
Awesome. I just wanted to start by sharing this image that I took while walking on the streets of San Francisco. It's funny, San Francisco lives in a bubble and think everyone is up to date with AI. And there was this huge billboard about skills from a company called Vercel. But then when you walk out of San Francisco, you ask anyone, they're like, what does skill mean? What does AI mean? And I thought we are living in two parallel worlds and thought just it's just funny I would share this.
Is nowhere that it's more true than in healthcare. Like, I think that a lot of people hear skills and they're talking about being able to do a crossover in a basketball game.
Yeah. Oh, cool. I would share Revel platform just real quick, just to show you guys how we're thinking about skills in our workflow. And what does skill mean in general, or anatomy of a skill as well, how you define a skill. So just one example here, we have post-surgery follow-up skill here. And these are, by the way, completely customizable by providers in our platform, and we're working on it. This is coming to our production environment soon. We are also integrated with EHR, where we can pull data, particularly very friendly with Athena, because Athena have open API ecosystem. So at a high level, the description field, and this is how Anthropic or Claude skills are defined as well, even though you can build those skills using by chatting or talking to your AI, which I'll show you in a second. Christian was already showcasing that. This description is really important because this tells your AI when to apply this skill or custom set of instructions on what trigger words or what task. So here, we are defining it like you activate the skill whenever a clinician is asking about post-operative status. Very generic skill, not real, but just wanted to showcase here. You give it set of instructions on whenever clinician ask about this, what are the downstream tasks you need to do, or how do you need to phrase the final output. And same goes for scribe as well. You can build these skills in post scribe as well. So as soon as scribe note is generated, looking at the transcript, AI can understand and apply different downstream tasks: communication for patient, communication for your staff member, or other downstream tasks. The opportunities here are endless. What you could also do is you can ground your skill into evidence-based content as well. So Revelai and have Schmidt-Thompson guidelines for triage protocols, obviously EHR fire search. Another example is on the bone content, which is very relevant for orthopedics. You could think of up-to-date content, open evidence. So as you apply this skill, it is also grounding the information with evidence-based data. Um, and this could be applied again in the chat workflows, training workflows, and post-scribe as well. And then you can give it some rough examples as well if you want to. So, how you want your prompts to be structured in general.
Yeah, this is awesome. I mean, I'm really excited about this, and for those listening, right, we're looking at basically this kind of split screen. On the right side, you've got post surgery follow up as the details of a skill. You've got instructions, context, and I think that what's really cool about this is you could execute a variety of different workflows that are relevant. In this case, we're talking about post surgery follow up. So let's say from the chat you say conduct post-surgery follow-up skill on this patient, and our system is going to query the patient for relevant information, actually have an AI assistant go out and call the patient, and then come back with information about how that interaction happened. That's, again, specified to the questions that you wanted asked and the information that you wanted surfaced to you.
Yeah.
Maybe you can show so many examples of this, right? Like maybe a lot of you have a Blue Cross Blue Shield prior authorization appeal, and you
Yeah.
need it to be structured in a certain way over and over again, and you want to make it so that you just drag the claim or the prior authorization denial into your chat window, and you want not just like a generic prior authorization appeal, although that honestly is pretty good in many large language models, but you want it to be structured in the way that you've seen previous prior authorization appeals be structured. Obviously, you still review it. Maybe you also want a draft of that information to ping members on your staff member who are on the platform in their inbox, and that workflow can be executed.
Yeah.
There might be an op note. You want your op note to have
Yeah.
to be flagged for specific verbiage. I mean, I think there's so many opportunities here.
100%. Another example is we're working with Dr. Del Sol and his team to draft IME documents as well, where you can upload certain documents to the AI chatbot, and it can do a draft of full IME documents based on your instructions. So a lot of prior auth or documentation work or this kind of like workers' compensation kind of documentation work can be done through AI as well.
And so for folks who are listening, independent medical examination, we get these files, 6,000 pages long of medical records, and you need that information to basically right now today you got to go through it either manually or you have a team that's helping you find the history of the imaging, of the treatment that's been delivered before. And in this case, you can develop a skill. And we have one of these where you drop that huge file and it gets parsed out, and you actually see the timeline from that enormous file of what happened to the patient when, and that can inform your final report. And you could use the system to even draft parts of your report. Obviously, super important always to have a clinician in the loop here, and you have to have your own final report submitted to the different organizations. But so much of that manual part that doesn't involve the clinical judgment and reasoning can be automated. And maybe you can include your ambient scribe note after you've had an encounter with the patient to automate that flow as well, which can be really powerful.
Yeah, 100%. Just real quick, another example I want to show you for a skill is like building a context around an organization as well. So we have these inbound agents where Revolai inbound agents will triage the calls coming to these practices, clinics, or health systems. And this is an example of ASAP Orthopedics, Dr. Kofi Ejimen Clinic. So one of the problem is anytime an organization want to go live with Revel, you have to build so much knowledge base about that organization, learn their protocols, their hours of operation, or other instruction manual. Another example of skill is, okay, you give your website, you drop in PDF documents or any protocols you have in your organization and let AI build a skill or a knowledge base for you. So next time when patient calls you and the call goes to voicemail or no one is able to pick up the call in your organization, we know about your organization enough and can answer any questions. So in this example, we gave a couple of documents, but mainly their website to scrape information from and learn about their organization. And all of this information that I'm showcasing on my screen is built by AI, actually learning about what kind of services they provide, what's their phone number, website, general information about, how you want to greet the patient, if they are taking off, what kind of message you want to deliver to patient, what is their hours of operation, holiday schedule. Not just that, also learning about providers in that organization and what they do. And then they can drop in any kind of triage documents, their clinical protocols or anything. And we bootstrap and build the skill for them to take a look at. So next time AI can use it. Obviously, they have to vet it and they can go and edit anything if they want to. Just want to share this.
Yeah, this is incredible, right? Because this used to be manual, and I think a lot of companies are still doing a combination of, on the back end, having their engineering team do a lot of this. It used to be we would go back and forth with the clinic. Hey, I need the AI assistant to say this, not that. Here's our hours of operation, or here's some things that are changing. This has really allowed us to deploy these AI assistants more quickly because now, first off, there's a user interface for the clinical team at the office to train someone on their team to make those changes and keep a change log and to test it before they deploy instead of having to bug engineering over and over again. And what's really cool is there's also outbound agents. So, scroll at the top here. And again, for those listening, we're looking at basically a split screen. Where on the right side, we've got managed voice agents, and we're looking at different examples of AI assistants that you can basically through the user interface program and change. We've got examples here of outbound AI assistants. And You could have an outbound AI assistant maybe that preoperatively is calling a patient and asking them, "Are you on a GLP-1? Do you have, we see you have a history of a blood thinner. Did you stop it at the right time? Do you need directions to the office?" Right? And you can include actually what information you need the assistant to collect and even customize the kind of note that gets generated or the alerts that come back. And these assistants plug into your workflow and your skills from what we were talking about earlier. And you can do it right here in the user interface, which I think is pretty cool and amazing. And
Yeah,
because we sign a BAA with you and, we're going through all of the rigorous security compliance, you're not worried about, trying to to open another browser and do this in an environment where you can't track all of the changes or you accidentally break HIPAA compliance, et cetera. Same
yeah,
goes for the Kimi chat skills.
100% agree. I guess just to wrap up on the skills, I know Christian, we're at time.
Yeah,
I think it would be really helpful for anyone who wants to play with skill is to use Claude and try to
totally.
build skills themselves. You don't have to write it yourself. You can put AI in a mode where it asks you questions, kind of an interview style. Keep answering that and then build skill, but also validate through an example communication from patient or whatever example task or a note that would trigger that skill. And we're seeing really interesting thing happening right now. You recursively in a loop can improve the skill by chatting through it. So
Yeah.
here I said I wanted to build a post-surgical patient check-in skill just for the sake of it. I'm not a clinical person, a doc. Just want to play with it. And I ask it to ask me questions back again, interview me what my protocol is, and you continue building it. And then you can give it some example, communication coming from patient. So I just build some context about the patient, market, and then what was the message that came from patient or a scribe note and see what it generates for me. So it did generate a triage framework, a message to the patient actually, and a message to my care team as well.
Yeah.
And you can continue building it until you like it.
Yeah, and this is kind of, if you will, how the sausage gets made for a lot of what we do at Rebel AI Health. We're on the HIPAA secure Cloud for Health Care tooling, and so like I do encourage everybody who is tuning in to just try out this tool and use it in creative ways. Like I would not assume that the large language model cannot do what you're interested in it doing until you've tried. Obviously, understand the limitations, but we need more clinicians and healthcare people in healthcare to be facile and fluent using these tools. And we're certainly committed to creating more and more resources for people interested in these kinds of tools. Just real quick in the last minute here, obviously, always feel free to reach out to us, either a techie surgeon, me, or Hadi. And I'm going to ask Hadi to share how people can get in touch with him here in a little bit. We're also trying to really build more resources for folks, both in the techie surgeon community and beyond. We're going to be launching this Claude for Clinic tool here and landing page. And some of the skills that we've put together, we will have available to you so you can play with them. We'll have some pre-made prompts, if you will, that you can also have and play with. And we'll eventually have more and more video tutorials on just using these tools because we think that the more people that are fluent in these tools, the better they understand the limitations and the better they can actually be at the table designing these different really powerful workflows and automations to make healthcare better, to improve patient outcomes. And I actually think we really want to empower patients to understand how clinical AI works and how these tools work across the spectrum, right? So that people can interact with these tools and understand the limitations as well. Um, Hadi, how can people get in touch with you? What are your closing thoughts? We got to talk about a lot. Um,
Yeah,
Please go ahead and let the users know.
yeah. I'll share my email and LinkedIn as well. I do have a Substack, but I haven't have posted a lot. I do have my personal website where I post, but I need to change. Maybe Substack is better. But I'll drop it my email and can share my LinkedIn as well. I think
Awesome.
I think the closing thought is yes, the models have improved, but we don't see a real world deployment happening that soon until interoperability laws changes or we have more ecosystem for the builders to build through. It's happening in other adjacent industries like fintech, financial tech, or even other kind of like, adjacent industries. But in healthcare, again, the data gravity lives in EHR. And how can EHRs create a more open ecosystem for builders to innovate and build through carefully, obviously, not to do anything insecure or less HIPAA compliant? I think Athena is moving there. It's really cool
Yeah.
to see what Athena is doing. They're already building model context protocol for AI to accept patient chart and everything. More EHRs, if they can follow their suit, it'll be a really good community.
It'll be a really good community. It'll be really good for clinicians. It'll be really good for patients. I mean, I still have so many patients who show up where I am trying to dig through their old records to see where they had imaging. Like a large language model skill could surface those things, have that information ready for you the way that you want it. If we just had more open access, not fully open, but more open access to these Fire APIs in particular. I think that regulation is moving that way. I think that it has been too slow. There's just no question here
Yeah,
that it's really a like a patient safety issue in my opinion that we aren't able to use this technology securely uh, and offer these tools context so that we can perform better clinical outcomes.
yeah.
These tools are only as good as the context you give. So
100%. And just to answer the question, since this was asked, are we saying we need a separate platform? We truly believe in system of records like EHRs and clinicians living there, not using two platforms. A lot of these AI workflows we believe are going to be ambient, meaning running in the backgrounds, reading the context from the EHRs and writing the context back into an EHR as a patient note, in basket notification, or whatever. We don't want people living in two tools. They use separate tools to configure AI, how to run ambiently on their workflows. But your view layer should remain system of record, which is EHR. That's what Christian and I believe.
And I'll say like, yeah, absolutely. And especially for users that are not AI fluent, that's what we found. It's just very hard for them to context switch. However, I will say I think there is tremendous white space here for organizations or startup companies to go that next step beyond software for health systems and providers and to be outcomes services. And this is what we're doing at Revel AI. We have staff extension opportunities for organizations we partner with, and when you do that, the staff are AI fluent. They're on your platform. They're interacting with the system. But I think there's a huge opportunity there, Juan, where you bring not just the software, but maybe the staff or the clinical entity that's trained and living on these super facile AI fluent platforms in connection with the system of record. But your care coordinators, your clinicians, they're working in concert with an ACO or with a large health system that's trying to comply with the new CMS model, et cetera. And like, there's no backlog on the implementation because you're like, hey, from day one, my team that's AI fluent is on this platform is going to, you just give us access to the right patients, you put the referrals in, and we'll show you the outcome. I think that that is going to be really powerful. And we need to see more companies going in that direction. But to do that, you need clinical domain expertise at the table, right? And then you need some of the models to catch up. And I don't mean the AI models, I mean the care models. And I do think with CMS transforming episode accountability model, where hospitals are losing millions, right? The access model, which finally paves a path to paid digital health benefits for Medicare patients, the ambulatory specialty model, which is going to affect a lot of clinicians, even MIPS. Like, there's just all these opportunities
Mm.
to just have a low lift staff extension that's living on the AI fluent tools and using it to expand their leverage, and focusing less on like the AI can do this, 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 and instead saying our organization is going to accomplish XYZ for you. Whether that's you're going to see appointment volume go up, you're going to see more care gaps closed, you're going to stop losing money on these episodes of care. So long-winded explanation there, but that, in my opinion, is the next phase of clinical AI: is outcomes as a service, not software as a service.
Yeah, 100%.
Awesome. All right. Hey, Hadi, thanks again. Guys, we're going to be doing this more frequently. We're going to call it a Founders Coffee series. And, we'll just casually kind of chat about the latest things we're doing, whether it's on Claude or in Revel AI or talking about the industry. Thanks so much for joining. And maybe next time we'll get somebody from the chat. We'll pull you in
Yeah.
to talk a little bit. I see Darren Michael in the chat here. He has done some incredible generative AI tool use for data analytics of publicly available Medicare data. And we're going to get him on here one of these days, just one on one. But next time maybe we'll pull him in to get his opinions as well.
Awesome. Thanks for having me. It was fun.
All right, take care, everybody. Appreciate you. I always have trouble ending the stack. Let's see. Here we go. All right, take care, everyone.